This is a presentation on radiographs of the shoulder for the primary care physician. The objective of this presentation is to review the various types of shoulder x-rays that can be ordered by the primary care physician. There are 8 common x-ray views of the shoulder: the AP external rotation view, the AP internal rotation view, the Gracie view of the glenohumeral joint, a lateral transthoracic view, the axial or axillary view, a scapular Y view, the AP and AP axial clavicle, as well as the AC joint series. In the AP external rotation view, the beam is directed at the glenohumeral joint in the anterior posterior view, and the arm is externally rotated. As you can see on the right, the greater tuberosity is very well visualized. In the AP internal rotation view, the beam is directed in the AP plane at the glenohumeral joint, but the arm is internally rotated. In this view, you can see on the right, you can see very clearly the lesser tuberosity. In the Gracie view, the glenohumeral joint is visualized. You can see in the upper left, the patient is tilted at a 45-degree angle towards the affected side. And at the bottom left, the view is directly through the glenohumeral joint. You can see on the right a Gracie view x-ray. It shows the open space of the glenohumeral joint. This is appropriate to evaluate for osteoarthritis of the glenohumeral joint, as well as after a total shoulder replacement. The lateral transthoracic view is a lateral view where the unaffected arm is raised and the beam goes through the thorax and the affected humeral head. You can see the humeral head and the neck very well to rule out any fracture. The axial or axillary view is probably the key view to rule out dislocation. Here you can see on the left the beam is going up the axilla, and here you can see on the right the humeral head and the glenoid, and you can tell if the humeral head is centered on the glenoid or not. In an anterior dislocation, it would be out in the front towards the coracoid. In a posterior dislocation, it would be posterior to the glenoid. This is a key view to ensure that the humeral head is reduced on the glenoid. The scapular Y view is also a somewhat useful view to see if there is a dislocation. I prefer the axillary or axial view as the key view over the scapular Y view. If you can see here on the left a normal scapular Y view, you can see here centrally an anterior dislocation. You can see on the right a posterior dislocation. When looking at the clavicle, it's important to get an AP and an AP axial clavicle view. Up on the top left, you see the beam directed in the AP view towards the clavicle, and you can see on the right there does not appear to be any fracture. When you do an AP axial view on the bottom left and bottom right, you can see the beam is directed north 15 to 30 degrees, and here you can visualize the fracture. The AC joint view is useful to look at the AC joint in the setting of an AC separation or distal clavicle fracture. You can measure the AC separation as well as the corticoclavicular space. This view is best done comparing to the contralateral side with and without weight. Oftentimes, without weight there will be no AC separation, but with a 2 to 5 pound weight there will be a separation visualized. So when do you order which views? Well, it really depends on what you're looking for. The standard trauma views are the AP external rotation and the scapular Y view. The standard 3 views of the shoulder is typically an AP, either internal or external rotation, the Gracie view, and the axillary view. For dislocation, I prefer the axillary view. However, sometimes a scapular Y view is easier to obtain. For clavicle fractures, you must get an AP and AP axial clavicle view. For an AC joint separation, you want to get an AC joint view bilateral with and without weights. To visualize a greater tuberosity, you want the AP view in external rotation. To visualize a lesser tuberosity, you want the AP view in internal rotation. For osteoarthritis and shoulder replacement evaluation, you want the Gracie view, which looks at the glenohumeral joint. Thank you.